Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. Lateral knee drops. We're going to be working on lateral knee drops, which is a progression that should follow hook-lying knee lifts, meaning you should master hook-lying knee lifts before moving to this exercise. Let's begin. From hook lying, first, make sure you're comfortable. Check your spinal neutral. We're going to use the same diamond pattern with the thumbs on the rib cage and the middle fingers on the hip points, called ASIS. First, we'll tip the pelvis back and forward. This is called AP neutral. And then we will check rocking or lateral neutral. Do this a couple of times in each direction, tipping first and then rocking. You'll find the midway point between each when the pelvis looks rather symmetrical side to side. Begin to lift the right heel and slowly drop the right knee out to the side, repeating on the opposite side, only as far as you can control the movement, as you see here, which means no rocking or tipping. This is difficult. At first, the movement will be small, not large as I'm demonstrating here. You may only move the knee out to the side an inch, maybe even less. That's okay. Everyone starts with small, slow, deliberate movements. If you need to, you can lift the head and check as I'm doing here. Keep monitoring with the diamond shape of the hands. Next, I'm demonstrating the incorrect way. See how when I let the knee drop to the side, the pelvis just rocks and there's no real stabilization happening. In other words, I'm not using TATD breath. Now let's look at a close-up of the correct way again. I'm reestablishing neutral, tipping, rocking. Checking that I have symmetry, and starting again. Check your throat, your thoracic diaphragm. There should be no tension in the neck, the face. Then move to the shoulders. Make sure you're not gripping or holding them in an attempt to practice knee drops with TATD breath. I also check the rib cage. Everything should remain stable. No asymmetry or tension. If you prefer, for advanced practitioners, I would recommend checking for rectus loafing or excessive use of the external obliques. And this is something that you can study in medical therapeutic yoga. This activity carries over to functional activities, like walking and running or lifting asymmetrical items. Thank you for joining me.